AVG that is suitable for conversion to a fistula. Now you are ready to select sites for cannulation and prepare the needle site. Infection is a major concern with any vascular access, and Staphylococcus is the leading cause of fistula infections in dialysis patients. Proper needle site preparation by both the patient and staff reduces rates of infection. Kedoki recommends that aseptic technique be used for all cannulation procedures. The best way to prevent an infection is to follow your unit-specific infection control policy and procedures. Proper infection control measures work only when practiced every day by all patients and all staff members. Deborah?
That's right. Patients should wash the skin over the access with an antibacterial soap before coming to the dialysis chair. Once the patient has washed, you select the needle sites before applying an antimicrobial agent. Use clean hands to examine the vascular access. Proper site selection is key in successful cannulation. Taking a few seconds to evaluate the fistula for cannulation sites may save time by helping you avoid complications.
Once the cannulator's hands are clean, what should he or she do?
Look and feel the fistula to locate the cannulation sites. Look for straight areas for at least 1 inch for each cannulation site. If you try to straighten out the vessel by pulling on it to cannulate, the vessel will retract to its original position when released and lead to an infiltration. To prevent complications, avoid aneurysms or flat or thinned out areas. Stay 1.5 to 2 inches away from the anastomosis. The arterial and the venous needles must be placed 1.5 inches apart. Each treatment requires 2 new sites. Then wash your hands or use an appropriate hand sanitation agent and put on clean, non-sterile gloves for the cannulation procedure. New clean gloves should be worn by the dialysis staff for each patient. The next step is to apply an antimicrobial cleanser. The Center for Disease Control has identified chlorhexidine gluconate as the preferred antimicrobial for skin prep prior to venous catheter insertions. Chlorhexidine gluconate has a persistent antimicrobial activity. It prevents regrowth of microorganisms on the skin for at least 48 hours. Completely wet the needle insertion site with strokes of chlorhexidine gluconate applicator for 30 seconds. Allow the area to air dry for approximately 30 seconds. Do not blot or wipe the area. Sodium hypochlorite is an alternative antimicrobial agent. Saturate a sterile 2x2 gauze pad with the cleanser. Start cleaning at the insertion site in a circular outward motion. Wait 2 minutes before proceeding with the cannulation. The skin may also be cleansed with 70% alcohol using a circular rubbing motion. However, alcohol has a short bacteriostatic action time and should be applied 1 minute immediately prior to needle cannulation. Once the antimicrobial agent has been applied, the fistula should not be touched again. If the cannulation area must be touched again, repeat the hand preparation, change gloves, and re-prep the access with the antimicrobial agent.
With the site preparation complete, are there any particular concerns a hemodialysis patient might have that the cannulator needs to be aware of?
Fear of pain with needle insertion is a very real concern for many patients. Various pain control options can be utilized to make the cannulation procedure less painful and therefore less stressful for patients. Pain control options should be used according to your unit-specific policy and procedures and physician prescriptions. One of these options is lidocaine, which can be injected under the skin but above the fistula vessel at the chosen cannulation sites. It is very important that lidocaine is administered intradermally, not intravenously. The advantage of lidocaine is that it numbs the area prior to the cannulation procedure. However, it can burn when injected and can cause scarring, vasoconstriction, and keloid formation. Lidocaine also poses a needle stick risk. Once patients experience the use of lidocaine for routine needle cannulation, they are fearful of trying needle insertion without the lidocaine. Thus, lidocaine becomes part of the procedural routine that is hard to change. Topical sprays, usually ethyl chloride, can be used to numb the skin sites. Sprays are a non-invasive method of numbing the skin. The disadvantages of topical sprays are that they are non-sterile, require a patient-specific bottle to prevent cross-contamination, may discolor or damage the skin with long-term use, and are flammable in the bottle. The procedure for using a topical spray is to spray the arterial site first, prep the skin, and then immediately insert the needle. Repeat the same procedure for the venous site. Topical creams contain lidocaine and may be applied by the patient at least 1 hour prior to dialysis. Creams numb a larger cannulation area than the topical sprays, but they do have disadvantages. They are expensive and they cause vasoconstriction. Be sure to educate patients on the correct amount of cream to use. Using too much cream may lead to a rebound effect, with vasodilatation up to 3 hours into the dialysis treatment. The skin must be washed prior to cream application. Creams are applied to the skin over the anticipated cannulation sites at least 1 hour prior to dialysis, and the site is covered with plastic wrap. Before the cannulation procedure begins, remove the cream, wash the skin, and then perform routine skin preparation prior to needle insertion. Refer to the package insert for full manufacturer's instructions for use. Have the patient fill the prescription for the cream and bring it to the dialysis unit so you can instruct the patient on the proper application of the cream. Document patient education per your unit-specific policy and procedure. Now you're ready to cannulate the fistula. The proper use of a tourniquet is required for all fistula cannulation procedures to help prevent complications associated with improper needle insertion. This includes large fistulas that appear dilated without a tourniquet. Using a tourniquet ensures uniform dilatation of the vessel prior to needle insertion. You need to apply the tourniquet tightly enough to enlarge or engorge the vessel, but not so tightly that you cause pain or loss of blood flow to the limb.